Welcome to the Australian Chiropractors Association podcast. The ACA is the peak body representing chiropractors in Australia. These podcasts explore the science, art, philosophy, and politics of chiropractic, as well as reviewing the latest research and discussing how chiropractors can strive for excellence in practice.
Welcome to Australian Chiropractors Association National Podcast. I'm your podcast host, Dr. Kim Lie Jom, and today we're diving into something that I think we could revolutionise how you assess your most challenging cases, the one of which the mouth-spine connection. As many of you would know, listeners, as chiropractors, we understand that the atlas affects everything below it. We see that the cervical spine is generally something where misalignments create compensation patterns throughout the entire kinematic chain. But what if I told you that the positioning of your patient's teeth could be the missing piece in understanding why their atlas keeps subluxating, why their forward head posture won't resolve, or why that they keep coming back with the same TMJ and cervical issues? I'm really excited today because I'm joined by Dr. Jalal Khan from Sydney Functional Dentistry, who's pioneering an approach that aligns perfectly with our chiropractic philosophy. As he sees the mouth as part of the whole body system, Dr. Khan his approach suggests that many of us who see these recurring unresolved issues might need dental intervention that works with your chiropractic care and not against it. So a little bit of a background first. Just so our viewers, I had the pleasure of meeting and listening to Dr. Khan at the ACA National Conference, and I was so impressed. I wanted to have him on our podcast to share what he knows and what he does can benefit and support chiropractic care. Dr. Jalal is a general dentist with a keen interest in the close interaction between mouth and body posture, as well as whole body health. He sees the mouth as being a key player in many postural compensations, especially upper cervical problems. For his adult patients at Sydney Functional Dentistry, he uses biomimetic appliances to deliver forces that help stabilize posture, reduce pain, improve breathing, and sleep. The dental treatment is always delivered alongside manual therapists who balance the body as the mouth is changed. Dr. Jalal employs a similar integrative approach for his pediatric patients as well, as his team at the quote-unquote the Quantum Kid guide the growth and development of their patients' jaws and faces. This approach helps to ensure their breathing is functional, sleep is optimized, and their autonomic nervous system is balanced and harmonious. Dr. Jalal Khan, thank you so much for joining us this morning, and so I'm so looking forward to this chat. Welcome.
Thanks so much for having me, Kim, and please call me Jalal.
I will indeed. No, I appreciate that. And yes, we're all pretty relaxed here, so I appreciate that first up. So Jalal, tell me, I'm really excited because like I was saying earlier, I was really impressed, and we were like, I know a lot of chiropractors who I spoke to at the ACA conference. We were all highly impressed with your presentation. So I want to really dive straight into this because we've got a little bit of time here, and I want to be able to share this information with. I know a lot of chiropractors listen in on our podcast, and I also know a lot of students listening in and new graduates, and they're all finding their feet. But I'm sure they will definitely come across, as I have over the last 30 years of working, this connection between the TMJ, the cranial system, and the cervical spine. So I'm going to pretty much dive straight into it. I'm really excited about it. You argue that the created teeth are functional compensations rather than mistakes. Can you walk us through a specific case where traditional orthodontics work created more problems than it solved?
Sure. I mean, there's countless, but the first one that springs to mind was just recently, actually. I had a
Mm.
16-year-old girl present to me with headaches and headaches and migraines, actually. And when we started to delve into the history, um, we started, okay, well, the headache started in, can't remember the exact month, but perhaps it was November 2024. And so I'm like, well, what preceded that? Was it like a motor vehicle accident or a whiplash injury or
Mm.
something to that effect? Because more often than not, like the body's always tending to health, right? But then, like, a trauma of some sort, a physical trauma, for instance, will throw things off course, and then the body's trying to reconcile that trauma. So I'm
Mhm.
always fishing for, like, is there a trauma that's preceded it? She plays hockey, so did she actually accidentally get, hit in the head, for instance, or, somewhere in her body by a hockey stick? And
Mm.
none of that really came forwards. I'm like, well, I noticed you're wearing braces. When did you have the braces placed on?
Mm.
And she's like, oh, the braces went on, and mum actually pulled out her phone and went to the calendar and found, okay, this was the initial braces appointment. It was like October 23rd. I'm like, I think that's
That's true.
I think that's trauma, and I think that spells the story. And it's
Hmm.
a very bold call for a general dentist to say to any parent that spent several thousands of dollars,
Yeah.
on braces, etc.,
Yeah.
as well as arguably contravening an orthodontist who's a specialist, treatment planning, to say that your migraines and headaches are actually from the braces and they need to come off, in my humble opinion. And so
Hmm.
I did present that to the parents and the child as an option,
Hmm.
and it was not received, like happily, but mum understood where I was coming from because
Hmm.
the data just stacked up. And so
Yeah.
um, it took them a few months to make the decision. And then they asked for me to take the braces off. I said, sorry, I can't. It's got to be done by the orthodontist that
Hmm.
placed them on anyway. Eventually, mum did. Next day, headache's gone. And she hasn't had a headache
Wow.
and a migraine since. And so that was just like another kind of data set, another anecdote to reinforce my understanding that crowded teeth are a functional compensation that the body is using
Mm.
to help us fundamentally breathe, right? And to keep our eyes parallel to the horizon, to the floor.
Hmm. Hmm. So coming back to that, with that said, how do you go about assessing? I know from a chiropractic point of view, we have certain assessment protocols that we do, but how do you assess craniosacral mechanisms with what you do? What are some of the signs that tell you when the system is compromised from your perspective?
Yeah, sure. So I mean, I haven't had any kind of formal, degrees or anything in, cranial assessments or anything like that. I
Hmm.
have attended a 5-day cranial course, a cranial osteopathy course in the States, and so you kind of learn how to palpate not only the cranium but also the sacrum, and that was life changing for me just
Hmm.
to be able to really feel that inherent motion, the CRI, and so I do cranial palpation to assess, but also like you can kind of get a gauge of what's going on with the cranium just by looking at someone front on and also side profile because if one eye's higher than the other, if one ear is more turned out than the other, if the front of the face feels more flexed but the back of the head feels more in extension or vice versa. These are all things which I can see just with physical observation, but also with cranial palpation. You start to piece the clues together and
Hmm.
understand that there are like some kind of cranial base strains, which more
Hmm.
often than not, there's one laid onto another. It's never just like an easy algorithm per se. But
Yeah, correct.
but you can kind of get an idea of like what's going on with someone. Is there like a serious strain that's going on that could be causing some compensations, right? But then also looking further down, what's going on with the shoulders and the hips and the feet, etc. Because it all, as we all know, it's all connected, so it
Yeah.
reverberates down. And I guess I just spent heaps and heaps of time with manual therapists,
Hmm. Hmm.
because I think as dentists, we don't spend enough time with um, manual therapists that are working with the rest of the body, and arguably vice versa, if I may
Mm.
be so bold as to say that. And so I guess with me spending, I'm going to say at least more than 1,000 hours over the last, 2 years working alongside manual therapists or talking with them, etc.,
Mm.
attending conferences, etc. You just kind of piece together like an assessment. We also look inside the mouth, and what I've come to appreciate, there's a lot of dental presentations
Hmm.
that are like always found in specific cranial base strain patterns.
Oh, I see.
And so you can look inside the mouth and be like, okay, look, that side of the mouth is doing this and that side of the mouth is doing that. This is
Yeah.
what it's telling me about the right maxilla and the right temporal bone and whatnot. And so the
Mm.
assessment is it's obviously it's a thorough history, it's a cranial assessment, it's a postural
Hmm.
assessment, it's a dental assessment,
Hmm.
and piecing all that together to understand number one, if I can help this person, and if so, how do I go about doing it?
Mm. Well, it's interesting because I know in chiropractic terms, having done work through SOT, there's a very strong relationship that we've always discussed with our patients regarding the relationship between the jaw, the mandible positioning, and the craniosacral rhythm. And so it makes total sense that now that you have that understanding and then also you're employing that sort of examination aspect to be able to see from your perspective, a dentist point of view, the changes in that, and then also seeing the results post treatment as well. So that's very exciting to see. And I know that a lot of chiropractors work with dentists, but I think what you're and what we're going to discuss a little bit further on is taking it to that next level too, which is so exciting to see. And that sort of symbiotic relationship that the two professions can have can only
100%.
benefit the patient in the long run, you mentioned the mandible serves as a. I know I've heard you mention it before, particularly at the seminar this year's conference. The mandible serves as a proprioception for the atlas. Can you explain a little bit about the relationship on how dental work might affect cervical spine misalignments or
Yep.
alignments in general?
Sure. And look, I mean, what I'm about to say is my current understanding, which,
Hmm.
may evolve over time. So I guess mandibular position is guided by the way the teeth bite together first. Like that's the first thing. All right. And so the way the teeth bite together, we refer to as occlusion.
Hmm.
And let's say if, the right upper teeth are a little bit further down compared to the left upper teeth, and that's going to alter the mandibular position. And AC Fonda, who was a dentist back in the day, if my memory serves me correct, at least 60, 70 years ago, wrote a book called Dental Distress Syndrome.
Hmm.
And in that, he laid out his own analysis, which he'd done with some really smart quantum mathematician, that the axis of rotation of the mandible was not an imaginary line between the two TMJ condyles, the mandibular condyles, but it was actually at the base of the odontoid process of C2.
Oh, interesting. Yeah.
And and so that was like when I read that, I'm like, holy smokes, like that's completely like different to what we're taught. And so I'm like, okay, well, if the teeth are defining the way that the mandible
Sits.
sits in space, and then the mandible's affecting C2. And I just remember from anatomy, head and neck anatomy, that like the dura mater attaches into C2 and C3,
Mm.
and then obviously passes in through the foramen magnum and fans out into all its various attachments, but then goes all the way down to the sacrum as well. Like,
Mm.
and we know the C2 is right under C1, right? And the reason the C dura doesn't attach into the atlas is, of course, just because the atlas needs to allow the head to move left and right, etc. So I'm like, I feel that the way the mandibular position affects the atlas is by indirectly by first influencing C2 position, and then that just reverberates up because the C1 sits right above C2. So that's my understanding on how mandibular position can impact the atlas. But then the cranial bones, like the temporals and the parietals, the frontals, etc., the SBS,
Mm.
that impacts the dental alignment, which I said right at the start impacts the mandibular position. So like it's this whole loop, and it's really about working out where's the primary.
Mm.
What is the first thing that's gone off wrong? And one of the things I try and do first, particularly with my adult patients, is I try and balance the mandible. So just get the mandible horizontal and just see how the cranium takes shape. And so like I'll use like a lower splint. These are in the more complex cases. I'll use a lower splint just to kind of balance out the mandible and see, okay, well, Now that we've got that squared up, a horizontal floor, so to speak, for the anterior part of the cranium, what does that now do to the sphenoid bone and the temporals and the atlas, etc.? And I work alongside manual therapists, as you know,
Mm.
uh, osteopaths and chiropractors, and they allow me to understand exactly how has the patient responded now with their atlas now that they've got this splint in, because I don't know how to work out what's going on with an atlas, but I'll work with someone that does.
Yeah, it's interesting because what you said there was key about finding the primary
Yeah,
problem. Obviously, you can chase around in circles, and often as chiropractors, our motto has always been to try and find the primary subluxation in terms of how it is that the person became symptomatic and what things are compensatory. What
What I
would that?
what I find, sorry to cut in,
Yeah, right, go for
is
it.
that once you disarticulate the teeth by placing a splint in, I believe it creates like space and time for the practitioner to find the primary. Like I think
Okay.
it's a lot easier to find the primary then.
Mm. That makes
So
sense.
so
Yeah.
so we might have a patient that's got an atlas that's straight and everything's hunky dory, and then I'll place one of my appliances in, and straight away the atlas goes out. And
Mm.
so it's like, okay, well, has the appliance done that, or was the atlas already out?
Mm.
And the body had its compensation systems to make it appear like it was straight, but now that we've disarticulated the teeth, the real primary has come to the fore.
Yeah, makes sense. Well, that's a great way to look at it. So the next question I have with what you've just said there would be, as a chiropractor, um, when we look inside the mouth, what are some of the systemic postural issues that we need to be looking for? Like from the mouth's perspective, inside, what do we as chiropractors need to be looking for?
So if like in terms of specific dental presentations, if that's
Yeah.
what you're asking, like
Hmm.
there are things like cross bites where like typically a normal bite or occlusion is when all the upper teeth bite on the outside or in front of the lower teeth. So the lower front teeth tuck in behind the upper front teeth, the lower back teeth tuck inside the upper
Mm.
back teeth. But if you see a cross bite where it's a reverse presentation, where the lower teeth are biting on the outside of the upper teeth,
Yeah.
that is a sign that something's going on that's driving
Okay.
that presentation. So like that's a key giveaway. The other
Hmm.
one is like obviously like just a very narrow and high palate, but a narrow and high palate isn't a problem per se. It's a compensation that the body's done for a particular reason. So I mean a lot of patients come to me saying, oh, I want a wider palate. I'm like, well, like who am I to know that that's exactly what you want and need? Like,
Yeah.
why do you want a wider
Wider
palate?
palate. Yeah.
Oh, because I want to breathe better. Why do you want to breathe better? Oh, so that I can sleep better. Oh, so your main goal is actually to sleep better. It's not to have a
Yeah.
wider palate
Yeah.
and more space for your tongue.
Hmm.
And that sends well, them and I down a big rabbit hole about, okay, what are the key drivers to sleep? Which is,
Yeah.
that's morning sunlight. That's avoiding artificial blue lights at night. That's turning your
Mm.
Wi-Fi off while you're sleeping. That's eating early, not eating at 9 p.m. All of
Mm.
those factors, which could be a big role to play why someone's not sleeping well, which is why the pediatric clinic that we have is called the Quantum Kit, because we don't just look at structure, we look at the whole shebang. And we're looking at all of these and educating families about all of these things, drinking clean water, eating clean, eating early, trying to eat when the sun goes down or before. All of those key factors, which are
Hmm.
important for the kids to sleep better and stop grinding and all of those types of things.
Yeah, that makes sense because obviously as chiropractors, we've always advocated for overall health. We look at the individual as a whole rather than the individual symptomatic parts that might present at the time. So love the way you've questioned and framed that questioning in terms of finding the real reason behind why they wanted, say, for example, a wider palate.
Yeah.
So yeah, it fits in so nicely. Now you say that the body I've read before and I've also listened to you speak. The body intentionally, quote unquote, you say it intentionally positions teeth for breathing. Now that we're talking about, say, breathing and sleeping, for breathing and function. How do you distinguish between beneficial compensation and, say, a problematic dysfunction, which is something that chiropractors often face too? Trying to work out, we mentioned earlier about primary issues, but how do you know there's not a beneficial compensation as opposed to a problematic one?
I would say I go by what the patient's symptom profile is,
Hmm. Excellent.
because I mean they're here for a reason, and if they're at my clinic and they're not sleeping well, they're exhausted in the mornings, all of that, that's important for me because it's a sign that whatever structural compensations I see are affecting function. My goal isn't necessarily like a perfect mouth per se. My goal is to alleviate the symptom profile and help with, the structural issues, the functional issues that they have. So there are a lot of times where I've seen a crossbite in someone's mouth, but it's perfectly functional.
Oh,
And so
okay.
it's like it's almost blasphemous to say what I'm about to say from a business standpoint. But I leave the crossbite there, like,
Okay.
like so it's all about symptom profile. I mean, when I was doing a lot more general dentistry, sometimes I'd have like an older fellow come in his mid to late 70s, and he had, this whopping crossbite on the right hand side. But like he was a picture of health. He was, going for
Mm,
a run every morning. He's in no pain whatsoever.
mhm.
He's fit, he's healthy, he's not overweight. Like, what's there for me to do?
Yeah, good point. Good point. I guess that comes back down to a really good history that you have with the patient, and then turn deciphering exactly what it is that they've come in for,
Correct.
which is so important. And I know that most chiropractors work very closely by good line of questioning that brings out in the history of the patient is exactly what it is that their goal is working with a chiropractor. So it makes perfect sense. Now I know that you use and I mentioned at the start there in your dental offices biomimetic appliances. Now that approach, how does that differ from the traditional, say, palate expanders or other orthodontic devices? Can you share a little bit with our listeners as to what's the difference between what you do and, say, traditionally other orthodontists or dentists have used?
Yeah, sure. So it's basically underpinned by a respect for nature. So there's man-made laws and then there's natural laws.
Hmm.
And natural laws are guided by a, a divine force.
Hmm.
And those natural laws, the way that they play out in humans is
Hmm.
essentially the forces that guide the growth and development of us from embryo through to fetus through to
Yeah.
a child and upwards and onwards. And so
Hmm.
um, one of the one of the quotes from an osteopath, actually, Dr. James Jellis, which struck me, I'll never forget, was like the embryological forces that drive growth and development can also be used for healing in an adult.
Oh,
And
nice.
so the biomimetic appliances that I use, biomimetic means mimicking biology. Essentially, what I'm doing is I'm just trying to mimic the embryological forces that the body itself uses to grow a child.
Yeah.
Why don't we use those same forces to help heal an adult?
Mm.
And so those forces are guided by natural law, which is the embryological forces that are
Mm.
imbued within us, the tongue, and all of that type of stuff, the cranial motion.
Mm.
Whereas man-made laws, it's kind of like, okay, well, orthodontists and general dentists will place a palate expander in and they will, have a little screw in the middle and give the
Yeah.
parents a key and you turn the key.
Yeah.
Hopefully it's once a fortnight, but some of them are recommending
Daily.
once a week, if
Mm.
not even more frequently, twice a
Hmm.
week, every day, for instance. And like where in the history of mankind has someone's jaw and face grown with a palate expander?
Yeah.
It's never grown like that. So what's happened is, I believe, is that we have a whole industry that is focused on having that we're sticking to algorithms of like, okay, from the upper first molar on the left to the right, we need to have 38 millimeters. But like
Hmm.
we're all different shapes and sizes.
Yeah.
Like Kim, you're taller than me from memory, I'm
Hmm.
pretty sure. And so like it's normal for you to have a wider jaw than me,
Mm.
you know. But mum, who's 5'3", like she's got a smaller jaw than me, but that's normal. And so
Mm.
why are we taking all children to the same size jaw.
Hmm.
And it's kind of like we're taking, this is the line that I use for parents, is where the penny drops is like, okay, well, are we looking at Charlie's foot and seeing that it's a size 6, but he's gonna be a big boy, we guess. So let's expand his foot to a size 11 foot now
Oh, yeah.
while he's 9 years old. Like,
Yeah.
that's not normal. So then why are we doing that in the mouth?
Makes
So
sense.
it's just really a respect for nature that, like,
Mm.
let's not use man-made laws which are going to disrupt and cause a lot of compensatory dysfunctions. But at the same time, let's respect nature and
Hmm.
work with the body and appreciate that an 8-year-old isn't supposed to have a 25-year-old size mouth.
Yeah. Yeah.
It's okay for the jaw to be a little bit small then.
Yeah.
Look at their size. So
Yeah.
let's focus on optimizing the healing force, the growth forces, the development forces, that the body itself uses to grow, and
Hmm.
then trust that the body will do the rest. And we
Yeah.
know we know it will.
Yeah, there's so many similarities with the philosophy of chiropractic in what you've just described there. It always brings me back to that the analogy of the cocoon, right? If we rush it by splitting open that cocoon, that butterfly is not going to be
Exactly.
suddenly a butterfly before it's supposed to be a butterfly. And
Correct.
so I love that analogy, and that's something that's always stuck home with me in terms of chiropractic, and also how we we try to observe those laws, those innate laws that the body has a capacity to heal when given enough time and the right conditions. So in effect, if I'm hearing it right, is your approach is very much observing nature's laws, innate laws of healing and the capacity to grow and heal. So I just think that that's such a wonderful symbiotic approach to a patient's care, very much along the lines of what chiropractic has been and says for a long time. So I love that.
Thank you.
Now I want to move into something a little bit different. Something that struck me when you spoke at this year's ACA conference, and there's a lot of things. Obviously, I've highlighted that. It's fantastic, actually. And this is a really good thing too. I really want to delve into this more. Your EMF theory, electromagnetic frequency theory on jaw size, is fascinating. Can you maybe suggest okay, so let me step back. Some of the people who weren't at this year's ACA conference when I was listening in, and correct me if I'm wrong, Jalal, is you're suggesting that the evolution uh, is adapting to modern electromagnetic exposure.
Yep.
Okay, now two things I want to ask you. Again, maybe sort of highlighting for those who weren't at the conference this year. What sort of evidence supports this, and how does this, in some way, change the treatment priorities or protocols that you might have for the person?
Okay, great question. So essentially, and this is why my pediatric clinic is called the Quantum Kit,
Yep.
because we have we are an electrical system, electromagnetic system.
True.
Okay. We have electrons flowing through us, and Maxwell's equations, display that when you have a flow of electrons, that creates a magnetic field, but also a magnetic field can influence the flow of electrons. So during the
Exactly.
daytime, we actually have sunlight, which is creating what's called the photoelectric effect, which Einstein won the Nobel Prize in 1921 for, or
Hmm.
22. Nobel Prize in Physics for the photoelectric effect. UV light excites electrons from their ground state into an excited state, and those electrons can flow. So we're
Hmm.
primarily running off electric fields during the day. But in the nighttime, there's no sunlight, so there's nothing exciting our electrons. So what's making the electrons flow through our mitochondria to produce water and ATP and all of that jazz? It's actually the magnetic field of the Earth. It's the Schumann's resonance, 7.83 hertz. So we run off the sunlight during the daytime, but the magnetism of the Earth in the nighttime. But we're sleeping in Wi-Fi, which is 2.4 billion hertz. Okay,
Now that you put it like that, whoa.
but our brain is operating at 7.83 hertz. I'll make the maths easier. We'll round it up to 8. 2.4 billion divided by 8, you can do the maths. Like
Yeah.
it's not good, right? And so
No.
what's happening is that the electromagnetic frequencies that are man-made, once again, it's that word man-made, that we are living in, um, are a billion times more than they were 100 years ago. And there's, I mean, you don't necessarily need any fancy research and literature to back that up. You just look around you, like we've got Bluetooth headphones on, the Apple Pods, and the cars have got Bluetooth in them, and we've got Apple Watches on, and all this type of stuff,
Yeah.
which is pummeling our body with all these radio frequencies. Okay, add to that, you've got electrification of society. And look, I'm saying all of these things, but and it's the inconvenient truths, but at the same time, we can't live in our society without these things as well. So it's
Mhm.
like balancing everything. But like if you read a book called The Invisible Rainbow, which I highly recommend anyone listening to read, Arthur Firstenberg lays out the chronologically the implementation of telegraph lines, and then in the
Mhm.
18 during the American Civil War, and then it was the electrification of society with Tesla and stuff in the late
Mm.
1800s, and then in World War One they introduced radios for
Mm.
communication, and
Mm.
then in World War Two it was radars, and then after World War Two during the Cold War it was satellites and
Yeah.
going into space, and then military radars after
Mhm.
that. And then finally in the 96, 97, it was the introduction of like the cell phone networks.
Mm. Mm.
All right. And he lays out what happens to health outcomes in a whole different spectrum of illnesses when each of
Mhm.
those things were rolled out. I mean, he lays a case that influenza is an electrical disease, and
Right.
it's a pretty profound case.
Mm.
And so there's all of that going on. So, I mean, lots and lots of research, a lot of it from Eastern Europe, to
Yeah.
show that man-made electromagnetic frequencies are impacting our health because they impact our health at the level of the mitochondria, which is where all our energy is produced.
Exactly. Yep.
And Dr. Doug Wallace, who's a professor, I can't remember which uni he's at in the States, but he came up with this mitochondrial bioenergetic basis for disease, which is very profound. But in a nutshell, the electron transport chain inside the mitochondria, which is the five proteins where ATP and water is produced, that that whole apparatus is negatively affected by electromagnetic frequencies. Um,
Wow.
And so in 2016, the Nobel Prize in Physics was for an area of maths called topology. And
Yeah.
what it showed was that when you expose matter to different electromagnetic frequencies, the size and shape of things changes. And for me, that means that the behavior of the matter changes. So then we'll jump back to the mitochondria being affected by the EMF. Okay. When you have mitochondria that are not working well, you have something called reactive oxygen species being produced. Reactive oxygen species is like oxidants, right? Too
Mm.
much of that. That's not good. You need a bit, but you can't have too much. So if you're
Mm.
going to flood a system that's already producing oxidants with more oxygen, you're actually adding fuel to the fire. Does that make sense?
Yep. Absolutely. Yeah.
So what my humble um, opinion on evolution, this last piece, which everything I've said previously is backed by literature and science.
Yeah.
What I think is happening is that nature and evolution is purposely reducing the size and shape of the matter in our face to change the behavior of breathing, which is the topology 2016 Nobel Prize in physics,
Yeah.
to reduce the amount of oxygen coming in because in doing so, we're then reducing the amount of oxidants that the mitochondria is producing. So we're not adding fuel to the fire. So it's purposely reducing the
Uh,
amount of oxygen in.
mm. Mm.
That's what I think is going on. And like sleep apnea is a compensatory thing that the body is doing.
Hmm.
It is not an illness. It is being done on purpose by the body.
Mm.
The body doesn't make mistakes.
Yeah.
And
I,
so in answer to the second part of your question then, so how does that play out for like my conversations with patients? My conversation with patients are very different to what they were 3, 4 years ago
mhm.
when I didn't understand this quantum physics basis for for how biology runs in our body. But I'm talking to the like patients will come to me with sleep apnea, and I'm having more of a conversation and an education about the importance of sunlight, the importance of all of these circadian rhythms and circadian eating habits and all that type of stuff.
Yeah.
Because if they are expecting that a dental appliance is going to be the be all and the end all and fix all their issues, well, that's laziness on their part and setting me up for failure
Yeah.
because it's like, no, let's set expectations right. Like, yes, I can help you, and the mouth might be a small piece, but I can't, it would be incorrect of me to change the structure of the face and increase the oxygen intake in a system which is thermodynamically inefficient because you haven't addressed the EMF environment and the EMF profile at home, and you haven't fixed your food, and and,
Hmm.
and you haven't got your morning sunlight, and you aren't doing your grounding and all of that type of
Yeah.
stuff.
Hmm.
So it's like, let's fix the system first, energetically, and then we'll do the structure at the end.
Mm. Yeah, it makes sense because we've often, as chiropractors, I know I speak on behalf of many other chiropractors, whereby addressing the root cause, you need to appreciate the body, why it's done what it's done in order
Yeah,
to get to the position that they are complaining of the symptom. I think the ultimate thing is how our body is designed to stay alive. It'll do whatever it takes to keep functioning, keep staying alive. It may not necessarily do the right thing in the long run, but ultimately its job is survival. Innately,
correct.
it's learning it's to survive. So with this adaptation to the ever-changing environment, it's trying to continually stay alive and surviving. That's what I'm hearing from your perspective, right? So that ties in nicely, would you say, like in terms of what we've been seeing, trying to talk about with our patients as well, yeah?
100% agree with you. I mean, like, diabetes, sleep apnea,
Yeah,
or heart disease, all of these things are the body actually trying to work out a way. How do I survive in this new
crazy.
electromagnetic field environment?
Yeah.
It's like, so listen to the signs and symptoms that your body's telling you and
Mhm.
take those and be like, okay, I need to make a change because you can't heal in the same environment that made you sick.
100%. That I couldn't agree more. That is so true. You have to change the environment, right? Then it falls into that realm of epigenetics, like the nature of
Exactly.
how epigenetics is you create the environment. That's what's going to trigger it off, right? So creating an environment that is healthy, that is, so helping the actual organism to survive, will enable the organism to continually keep improving and not naturally get healthier.
Correct.
Yeah, makes so much sense. Now, we've been talking so much, and we could talk for hours on this stuff, which is fantastic. I love it. Um, but as in terms of the listeners, the practitioners who are listening, I know after listening to this, I know they're going to send me emails and going to send messages to me about how do I approach this? How do I do this if I want to get started in something like this? What would you say if I was to say, give us one or two things that, in terms of stepwise, that the practitioner, as in a chiropractor, can do in recognizing this link between oral health and whole body function? What is it that they need to
Yep.
do first and foremost if they have never approached this and they listen to this and they go, this is fantastic, I want to do this. What's the first thing that they should be looking for, straight up?
I'll give you three, Kim.
Please.
First thing is pop on some gloves and look inside the mouth.
Yep.
Even if you don't know what you're looking for, just start to build in your brain a bank of different presentations inside the mouth. And the general rule is this: if it looks good, it probably is good.
Yeah.
Okay? But that's on the proviso that they haven't had orthodontics in the past.
Yep.
If it looks bad, as in it's not pretty, it probably means that something's going on.
Mhm.
Okay, so that's the first thing. Second thing is, um, take a couple of business cards and get your patient to bite on them and see what happens to the range of motion checks and the
Yeah.
posture and the neck and all of that.
Yeah.
So disarticulate the teeth. And the third thing is introduce into your history forms a few dental focused questions. You should have your own section in the history forms about dental things. And
Mhm.
those things that come to mind would be: have you had wisdom teeth extracted? Have you had any adult teeth extracted? Have you had braces? Do you have a wire behind your front teeth, top or bottom or both? Um, do you, what other things spring to mind? Have you had Invisalign? How many times have you had braces and or Invisalign? Because a lot of patients have had it multiple times because it failed the first time and everything relapsed and then they got it fixed again.
Yeah.
And why is that? Because the dentist moved the teeth here and the body's like, what'd you do that for? I want them here, and so it moves them back.
Mm.
And but the big one is the fixed wires, those fixed
Mhm.
retainers behind the teeth, the history of braces. Of course, you're all already asking the questions around, cranial traumas and neck traumas and whole body traumas. So you're already asking all those things, which is great. But those are some kind of like the key questions that clinicians should be asking adults.
Yeah.
For children, of course, ask the parents about like the birth history and all of that. What are their habits like? Are they tongue thrusting? Are they thumb sucking? Are they
Mm.
biting on
Mhm.
do they have a habit of chewing on their collars or biting buttons on their shirt? All that type of stuff, which from my perspective could well be the body kind of finding a way to decompress the skull using the mouth.
Oh, yeah.
So thumb sucking, a lot of the time they're pressing up against the roof of the palate, but they're just
Yes.
trying to push the sphenoid bone back up because there's an inferior vertical strain.
Ah,
Um,
makes
so
sense.
the thing is that like my big learning curve over the last 5 to 10 years, trying things and them working and not working, etc., and trying to be better for my patients, is that the mouth is this functional matrix, this functional space which can be used for chewing and speaking and swallowing and breathing and all that type of stuff.
Mm.
But at the same time, it's also it's also a key player in the postural circuit. Arguably, one of the kind of closings of the circuit is in the mouth, feet
Mhm.
on the floor and teeth biting together. Um, That's what I think. I could be wrong. Happy to be wrong and happy to learn more. But the third thing is that the mouth can be used as an instrument for healing because when you bite on teeth, they send force vectors up through the cranium
Yeah.
and that can help to decompress. That's why kids do the habits that they do, biting the
Yeah.
nails and this and that.
Yeah. Okay. That's a wonderful perspective on it because I think that a lot of chiropractors would probably come across kids and kids who've become adults and are still doing the same thing.
Yep.
So yeah, so Jalal, this has been an absolutely eye-opening podcast. I really appreciate your time. As chiropractors, we're always looking for the root cause, and you've shown us that sometimes that root cause might be hiding in plain sight, right there in our patients' mouths.
Yep.
So as you've said just then, so that's fascinating. So, what really excites me about this conversation is how it validates what we already know as chiropractors, and a lot of chiropractors will agree with me, is that structure affects function. Okay,
Yep.
everything is connected, and the body's compensation tells us a story. Jalal, your work shows us that dentistry and chiropractic are natural partners. I think so anyway. And we're both focused on the whole person rather than just the isolated symptoms. Would you agree?
100% agree.
Yeah, wow, that's fantastic. Well, thank you so much for your time today. I really appreciate that. And I know our listeners will be really excited to hear and for the first time watch this podcast. So I'm really excited by this. And I hope that we as chiropractors will continue to work with our dentists in our local area and then in turn develop that symbiotic relationship and then work towards for the betterment of our patients.
100%. Thank you, Kim. I mean, for me, just to add, like one of my goals is to get more dentists to think like this.
Mm.
So a lot of chiropractors, particularly if they're interstate, because I'm based in Sydney, they're going to be like, where am I going to find a dentist that is going to be a bit open-minded and think like this? And it's not easy. Like it took me a long time to get here.
Mhm.
Um, and I'm not there. There's always more to learn. But like we do courses at the Quantum Kit to teach dentists about the approach. It's open to manual therapists as well
Mhm.
because there's only a few of us in Sydney, but like we want it to go Australia wide. We want more and more dentists to be thinking like this because it's just beneficial for the patients and it's really beneficial for the clinicians because one of the big things that a lot of the manual therapists who attended our recent course at the Quantum Kid were feeling and actually voiced was that at the Quantum Kid, the manual therapists that are working there are not always doing damage control,
Mhm.
but they're actually like participating in healing because they're not having to fight, particularly with the manual therapists that work in the pediatric space. You're constantly fighting all these dentist and orthodontic interventions, and you can't get anywhere with the child. You
Yeah.
can't you can't get the autonomics to land and all that type of stuff because of all this going on.
Hmm.
It was um it was pretty cool to hear that.
Yeah, yeah. No, that's fantastic. Oh gosh. Well, I'm looking forward to what this space holds in due course, and I can't thank you enough for your time today, Jalal. Well, that's it for everybody. Thanks for listening. I hope this podcast has been helpful in your quest for excellence, and I look forward to chatting with you all again at our next ACA podcast. Take care and stay connected.